So, hello everyone. Today we're joined with Temitope Creppy, and he's here to talk to us about the Howard University Sickle Cell Center and his experience. So, yeah, I'll hand it over to you now.
Yeah, appreciate you having me, man. Glad to have this conversation.
Yeah. So, our first question is, could you tell me a little bit about your work at the Howard Sickle Cell Center and how you support your patients?
So, I graduated now, but I've been working at Howard Sickle Cell Center since like my freshman or sophomore year. I was a
Wow.
work study student in Dr. Rana's hematology HIV research unit,
Wow.
the pediatrics wing. I've been with the center since like my freshman and sophomore year, work study, and then after 2 years or a year with them, I started helping with the screening program at the Sickle Cell Center adults like
Oh,
section. Yeah, so I've been
that's
here
really
for like
cool.
a long time. I ain't gonna lie.
Have you really enjoyed your experience at Howard University?
Howard, yeah, Howard like a it's like a family. It's like a family vibe, especially
Yeah.
Sickle Cell Center. So since the center was started in 1970 by
Yeah.
Dr. Roland B. Scott, Howard is the first and the oldest sickle cell center in the country.
Wow.
Um, so I think there's only been like a handful of directors. So like every year we have a sickle cell walk, right? Where we have like
Yeah.
a marathon and thing, fundraising and awareness event for sickle cell. And like the directors still come back. Like you know what I'm saying?
Yeah.
This people who used to work there still come back. The patients, they come back, their family comes back. So it's really like a family vibe. Everybody really knows each other, which is pretty cool.
Yeah.
Yeah, it's real
Yeah, I
cool.
think that's really cool to like foster that community and get people to want to come back too.
100%, 100%.
Yeah. Yeah. So then that leads into our next question. So I know you've worked in the pediatric clinic at Howard, and how does that compare with working with adults that have sickle cell disease?
So I worked in the P's. That was the first time I ever worked in sickle cell. So that's when I learned everything, like how is a genetic
Yeah.
disease and the symptoms and how it's passed on and things like that. So it was really informative.
Yeah.
But the thing with P's is like there's a lot of support for pediatric thing. The issue comes with like with transition to adults. That's when like the
Mm,
support and the foundation of care kind of gets lost since there's a huge focus on
yeah.
pediatrics. So like when people kind of age out, that's when some people like kind of lose in touch with their primary care physician or they,
Mm,
saying things like that. So that's kind of like
yeah.
what I noticed from pediatrics to adults.
Yeah. Because it's kind of like you spent all that time like building your community and then you have like that sudden change.
100%, yeah. So it's just more
Yeah.
about trying to put things into play to ease that transition. You know what I'm saying?
Yeah.
Because at first there was a huge focus on pediatrics in my opinion because back then since there was a lack of clinical care, lack of research, lack
Yeah.
of awareness, people living with sickle cell didn't live that very long. So
Mm,
now it's like folks living with sickle cell are living into their 50s, living into their 60s, living to older ages. Like I think now the median age is like 40 something, but back then it was
wow.
like 20s. You know what I'm saying? Back then it was like 20
Yeah.
years. People were dying in their 20s. People were dying at like 7, at 5, things like that. So it's just more of trying to build support from the peds to adult transition, like we saying.
It's really interesting because I feel like a lot of people never think about like how that transition might affect people with sickle cell disease and all that. So thanks for bringing light to that.
100%.
Yeah. So then my next question is, are there any experiences from the sickle cell clinic that really stood out to you or was really meaningful?
Really being educated on the stigma that folks with sickle cell disease go through, right? A lot of
Yeah.
them when they end up in it when they have their sickle cell crisis and they go to the ER, they go to the doctor, and they're pain. A lot of physicians or nurses or health workers um, aren't properly informed on sickle cell disease, so they see them as pain seeking. I mean, not pain seeking,
Mm,
drug seeking, like drug seeking. They think
yeah.
they're like drug abusing. They think they just are here because they're drug addicts, but not like they're really just in pain, and they really just
Yeah.
need, the medication to ease that pain. But so I think a lot of the things that I learned there was learning more about stigma that they go through, and
Mm, yeah.
trying to bring light to that and things like that. So yeah, that's what I would say.
Thank you for sharing that. And I would
Yeah.
say too, like I've noticed like with the different patients I've talked to, a lot of it is like education around the disease. They feel like that's the
Hmm.
biggest way to break the bias that there is surrounding sickle cell disease. And like you said, the drug seeking
100%,
stereotype that's out there
hundred
too.
percent. And
Yeah.
everybody with sickle cell doesn't have the same, not like same story, but like it's not like the
Yeah.
treatment. and the care isn't just a one fit all, right? You
Yeah.
have to have a real personalized understanding of, the patient and what they need, and really to tailor that. You just can't put, a formula to everything. You really have to build a rapport with your patient and really learn like what they need and how they go through things and how they feel
Mhm.
pain and how much, support or medication they may need. So
And then that leads into our next question. I'd love to hear more about the screening program at Howard. I know I've heard about it a couple of times where you can test for like different sickle cell traits or things like that. And I was
yes, sir.
wondering like how does that help patients or just people in general?
So the screening program, so Howard screening program, been doing it since the 70s and 1970s. Um,
Yeah.
in the region, Howard is the only, university institution that does outreach screening events. So we do, so Howard, the center is a six-folded, is clinical care, research, outreach, education, screening, and counseling. And to our knowledge,
Wow.
is the only institution that does that. All six
Yeah.
of those things. Um,
Wow.
Yes, sir. Yeah, it's crazy. So they've been doing that since the 70s. Like Dr. Scott um, and Dr. Cardozo or Castro, I think, in like 70 something to eight. It's like 72 to 81. They screened like
Yeah.
20,000 people, like a
Wow.
10
Really
year
impressive.
span. Yes, sir. It's crazy. They screened like 20,000 people. So now we just continue that mantle. So we screen all throughout DC. We screen at Howard
Yeah.
Hospital, any health fair events in DC or in the PG County, Maryland County, Montgomery County area we go to. We now received a grant from the Maryland State of Health, Department of Health, to screen at
Yeah.
all health departments and counties in Maryland. So we're going up to Baltimore City, going to the Eastern Shore, going throughout Maryland, which that's pretty
Wow,
cool.
that's good news.
But the reason we do the screenings is that since the sickle cell disease is genetic disease, it's passed down through inheritance, through parent inheritance, right? So a lot of people don't know their
Yeah.
trait status. So we do the screening so people be informed of their trait status, um, because that's how it gets passed down. Obviously, so we also have genetic counseling for those who have positive trait results that
Mm.
goes through like the family planning of having trait and what that means when it comes to like family planning and things like that. But also, it's been
Mm.
documented
Yeah.
that knowing your traits is also important because some folks with a trait do experience certain health conditions. So now all athletes in the NCAA college athletes are required to know their trade status because some athletes have, died not knowing their trade status because their body
Yeah.
gets overworked doing the physical exercise and the trait, status affects like oxygen going to your body and things like that. If
Mm.
you go to high altitude places like Denver, or if you in an airplane, you do feel certain, um, not Christ-like symptoms, but you do
Yeah.
feel certain anemias and things like that.
Mm.
So yeah,
Yeah.
it's important just to know for your health as well. But we don't. We also treat sickle cell trait. We screen for that, but we also screen for other hemoglobinopathies, so like thalassemia, things like that. So we give you the whole panel. So
Wow.
yeah, I think we saw within the DMV region about 13% of those tested do have sickle cell trait.
Wow.
So it's good to know. Like in Nigeria, for example, or Congo, where I'm from, about like 20 to 25% of the country has sickle cell trait. So
Mm.
yeah, it's just important just to know your trait status and things like that.
Yeah. And I thought it was really cool that you really mentioned about how, like, even if you have the trait, you can still be affected by the trait. Because I feel like a lot of people are under the impression that, well, you just have the trait, you won't show any signs of it. So that was really
No,
cool and
it's
interesting.
definitely some effects. So just going out and just building
Yeah.
that community trust with our screening program is really good. Um, brings a lot of awareness to sickle cell. Everybody has a story with somebody living with sickle cell that they know. So a lot of
Yeah.
people are eager to learn more about it and eager to support and things like that. And is also important that Howard does a HBCU because of the history of like medical mistrust within the
Yeah.
country, like things like Tuskegee and Henry R. Lax and things like that. So for us to do this community outreach stuff is a big thing to tackle those stigmas and things like that.
Oh, yeah, definitely. Well,
Uh,
thank you so much for your work. And then my next question is, you're involved with the Maryland Sickle Cell Advocacy
yes,
Coalition,
yes,
and
sir.
can you share how you or their advocacy work has really helped to improve education or resources for people living with sickle cell disease?
So for the past couple years, I've been advocating, trying to get a couple bills passed in the state of Maryland. So one has to
Yeah.
do with so there's 5,000 people in the state of Maryland living with sickle cell disease, estimated, but there's only been one sickle cell clinic in Baltimore City and John Hopkins. So you got to think Maryland's a big
Mm,
state. So
yeah.
if you're looking for care, if you're in an emergency, state, there's only one place you go to it. So like it's a huge transportation barrier, access to care
Mm,
barrier to go there. So
yeah.
we've been trying to implement opening more clinics and hiring more professionals in the state of Maryland to alleviate those barriers, right? And the second
Yeah.
thing we're trying to do is provide a law that provides accommodations for students in college living with sickle cell. Because living with sickle cell, you have to go to the doctor a lot. You may
Yeah.
miss classes and things like that. So having accommodation or having education workers that's trained in understanding of sickle cell allows students to you know um, allow students to like maneuver through higher education and things like that.
Yeah.
Because they miss class, they may need more time doing assignments, they need more time, doing the tests and things like that. So it just provides that foundation because it's hard to keep up with your assignments and things like that. So that's what we've been trying to advocate for in Maryland, just to build institutional support because sickle cell has historically been neglected when it comes to things like policy and funding and awareness. So
Yeah.
that's kind of like where we step in, right? So sickle cell was discovered in like 1910, 1904, but it didn't federally become, institutionalized until 1972. You know what I'm saying? So
Yeah.
we still feeling a lot of those effects here. So like that's just what we kind of do in the state of Maryland.
Yeah. Thank you so much. That's really helpful. And
Yeah,
for my final question, I was just wondering, what advice would you give to students who want to start their own initiatives or different campaigns for sickle cell disease just to increase awareness and advocacy? And like whether it's like with legislative like branches or anything like that, or also just like in general.
I would say it's important to know that you do have a voice, right? That you can start anywhere. Like what you guys are doing is amazing, right? So
Thank
I
you.
would say it's important to know that you have a voice and
Yeah.
find other people that are committed to the cause like you, and just start posting things about sickle. So just start bringing
Yeah.
more awareness, start educating yourself to educate other people. You know what I'm saying? Everything really does start
Yeah.
in education. So it takes one to teach one. So that's what I would
Yeah.
say. Just start with having that confidence and that self assurance that you have a voice. Then and that will take you where you need to go. I would say depending on where you are, where's a local sickle cell center near you, and try
Yeah.
to see if you could volunteer or help out. See where that is. That's kind of how I got. Well, that's not how I got started, but that's how I got started in the screening program at least. But oh yeah, whatever your local sickle cell place is, try to
Yeah.
help out, try to volunteer, things like that. You can also donate blood to the Red Cross. I know they have a sickle cell division where you could donate blood for like blood transfusions and things like that. So I would say those three things. Try to get involved there
Thank you so much.
for sure.
And I just want to thank you so much for your time during this interview, and it's been really insightful.
Nah, I appreciate you for having me though. I'm honored, man.